Keeping Up with Jones, the Lonnie Jones podcast adventure. I am your host, Lonnie Jones. My wife Jackie and I moved to the city of Huntsville in 1986 for me to be a youth and family minister. I have been a minister since 1980. I have served in this community as a police chaplain assigned to a SWAT team since 1992, and I've been in private practice as a licensed professional counselor since 1998. I'm also an adventure educator and an avid outdoorsman. I dabble in rock climbing and I goof around with Brazilian Jiu-Jitsu. Our life has been full of many wonderful experiences and some just outright adventures. I used to write about those things in a little church bulletin article. So now instead of asking you to read those things, we're just going to talk about them in our podcast. And as we talk about them, we're going to talk about the facts. The facts lead to concepts, and the concepts lead to application. One caveat about the facts is, for the most part, we're going to tell you the facts just as they happened. But every now and then, we're going to tell you the way other people have told us they remember it happening with a little bit of embellishment. It's all good, clean fun and for educational purposes. Thank you for listening, and we hope you enjoy Keeping Up with Jones. Faulkner University announces a 60% tuition discount for members of the Church of Christ. Now, there are some guidelines. This 60% tuition reduction is applicable to adult undergraduate Bible degrees or graduate Bible degrees from the Curley Graduate School of Theology in the VP Black College of Biblical Studies. You must satisfy all admission requirements and maintain satisfactory academic progress. You must remain continuously enrolled, including summers, until the completion of the degree. You must provide a letter from an elder or minister, preferably on church letterhead, verifying that you're an active member of a Church of Christ congregation prior to your initial enrollment. This offer applies to adult undergraduate degrees such as biblical studies, youth and family ministry tracks, and it also includes graduate degrees. And those are the Master of Arts in Biblical Studies, the Master of Arts in Family Life Ministry, or a Master of Theology, and it also applies to the PhD in Biblical Studies. For undergraduate inquiries, please contact Adult Enrollment, 334-386-7140, 334-386-7140, or Adult Enrollment at Faulkner edu. That is Adult Enrollment at faulkner.edu. For graduate inquiries, please call 334-386-7539, 334-386-7539. Graduate enrollment at faulkner.edu. That is graduate enrollment at faulkner.edu. Faulkner University is a sponsor of Keeping Up with Jones, the Lonnie Jones podcast adventure. TKM Incorporated in Moss, Tennessee is a construction company that specializes in erosion control, seeding, and soil, hydroseeding, hydromulch, minor excavation, and silt fence. They also provide traffic control and construction signs. Their business is keeping people safe, but their passion, their mission, is they wish that all men could be saved. TKM has adopted the nickname the King's Men because as they serve you, they also serve the King. If they could provide any of their services for you, please contact them at 931-243-3958. That is 931-243-3958. Or you can contact them on the net at tkminc2001 at twlakes.net. That is tkminc2001 at twlakes.net. TKM Incorporated is a sponsor of Keeping Up with Jones, the Lonnie Jones podcast adventure. The first FBI agent I ever met was also 400 years old. I was doing my practicum for the master's degree I was trying to earn. This was my last semester. And I'd been assigned to work at a mental health center from 8 to 5 on Tuesdays and at a rehab center from noon to midnight on Thursdays. If you end up at Cedar Lodge on Tater Tot night, something is wrong in your universe. This was my very first day. I got assigned to observe a psychiatrist who was an octogenarian, and she was about to interview a gentleman who was paranoid schizophrenic, and he was one of the clients at the mental health center. This was going to be the spring of 1992. I had been a youth minister for almost 11 years, and I'd done lots of counseling. I'd sat with students and parents and congregants and sat in elders' meetings and dealt with people in crisis. And even though I had that kind of experience, I sat nervously in this clinical setting as this gentleman entered the room. He sat facing the doctor, crossed his arms as if he were wearing a straitjacket, which he wasn't. And somewhere in the early part of the interview, he announced that he was 400-year-old FBI agent. Okay, I'm 13 weeks away from a master's degree in counseling psychology. I can handle this. I, without being asked to, interjected. Sir, the country's only been here for about 216 years. The FBI wasn't created until 1908. You can't be a 400-year-old FBI agent. To which the gentleman calmly replied, I said I was 400 years old and an FBI agent, not that I had been an agent for 400 years. Try to take better notes. This gentleman was struggling with what is known as delusional thinking. Delusional thinking is described as holding false beliefs or judgments about external reality that are held despite incontrovertible evidence to the contrary. Typically, it's a symptom of some kind of a mental condition. His mental condition was schizophrenia with paranoia. Now, during the same interview, and this has nothing to do with the podcast, I guess, but during the same interview, the same gentleman got triggered by some disturbance that only he was aware of. He leapt into the air and straddled this 80-year-old doctor in her chair and started raining bombs on her like he was in the UFC. I, being the only other person in the room, decided to intervene. I grabbed him and pinned him in a corner with an arm lock and a wrist lock combination. And I'm thinking this whole time, well, my last 4 years of graduate classes from 6 to 10 every Monday, Tuesday, and Thursday night just got washed down the drain. I have just put my hands on a client, and they are going to kick me out of the program. As predicted, at the end of the day, I got to meet with the director of the center. I walked into his large office and I stood at attention in my little dress shoes, my Rockports. I had a button-down shirt, khaki pants, and a little tie. And I stood there waiting for the hammer to fall. The director looked up from the huge mahogany desk and the paperwork he was dealing with. He had not acknowledged my presence, but he looked up and said, "So, Mr. Jones, I understand you bring a unique skill set to our facility." I began to backpedal. "No, sir, I have no skills. I just have a hobby." He said, "Relax. We have work for you. Don't feel compelled to wear a tie and feel free to wear sensible shoes." And for the next 8 weeks, I got to deal with the combatives, those people dealing with oppositional defiant and people with intermittent explosive disorders. Yes, I partially earned my master's degree as a bouncer at the local mental health center. And as I often do, I digress. I'm a 400-year-old FBI agent. That's identity. That's not self-image. That's not self-esteem, but identity. And how people identify their identity has been talked a lot about these days. Please go to the show notes and read some extra material that I'm going to include. And this is not an exhaustive or a fundamental explanation of all these things. This is just a comment, and it will not be a brief comment. But convincing ourselves we are one thing and being that thing convincingly are two different constructs. You see, my first contact client at the mental health center was neither a special agent, nor had he reached the ripe old age of 4 centuries. But there was nothing I possessed, nothing I could do, nothing anybody could tell him to make him ever change his mind. And it wasn't that he desired to be or not be 400 years old, and he didn't have a desire to be or not be an FBI agent. That's just what existed in his mind. And that's called a delusion. Transgender, gender non-conforming persons do not fit this category. There are no little boys who believe they are actually little girls. And there are no little girls who actually believe they are little boys. If or when that occurs, then you're dealing with delusions, and that's not transgenderism. Transgender is different. You see, the individuals struggling with gender issues don't think that they are or are not one gender. They have a deep-seated, unshakable, torturous discomfort about being male or female. Just think about hating the fact that you have red hair, or think about the fact that you hate looking in the mirror and seeing that you're going bald. Now take that discomfort and multiply that by 1,000,000,000, and then believe that you have decisions made about you and for you because you are bald or have red hair. Now, people who are bald or have red hair either dye their hair, wear wigs or toupees, and when they respond to that discomfort, they're not considered mentally ill. You see, the real question in these type situations is about not what you feel about it, but what is the level of distress and how you are adjusting and how you are coping. If you've never experienced being uncomfortable in your own skin, then you can't relate to the transgender, gender non-conforming people. Now, if you've ever thought, or you've ever felt, or you ever believed, I'm too tall, I'm too short, I'm too fat, I'm too thin, I don't like my nose, I wish this were different about me. If you've ever felt that way, then just multiply that exponentially and make it a pervasive, distressing thought or feeling, and have it present every single moment of every single day. You see, medically and psychologically, this intense discomfort is called gender dysphoria. And gender dysphoria occurs either psychologically or physiologically. Now, psychologically, it is described in the DSM-5. Now, the DSM-5 changed the gender identity disorder in 2013, and it became what was known as gender dysphoria. And the change focused the diagnosis on not on the gender identity, but the distress that's related to the identity. And the focus was not as much on the individual or the specific identities themselves. And that's super, super important in understanding this. The presence of gender variance is not the pathology, but the dysphoria is from the distress caused by the body and mind not aligning and or how they are treated in society. See, unless it becomes ego dystonic, it will not qualify as a diagnosis. If it doesn't cause dysfunction, if it doesn't disrupt the ego, then having this belief or having this feeling or having these thoughts is really not a disorder. It is not the belief that you're unhappy with your gender. It's the thought or the feeling that I'm a different gender, and that's not the disorder. But the extreme depression, suicidal ideation, distress, or anxiety related to the belief that makes it pathological or makes it unhealthy. You are not mentally ill if you have a deep, deep feeling that you don't like being short, fat, skinny, bald, or redheaded. The psychological component of the disorder comes in the fact when that uncomfortable feeling, that dysphoria, creates problems in functionality. Now, my job as a friend or therapist or minister is not to try to convince you that you should be happy, that you should enjoy being tall, fat, short, skinny, bald, or redheaded. My job as a therapist is to help you deal with how you respond to those thoughts, feelings, or beliefs. Depressed people don't feel good. Anxious people don't feel safe. Suicidal people don't feel as if they have any hope, resources, or value. And in all these cases, the treatment for that is not to be affirming. It's not to help them accept the fact that they feel terrible, the fact that they feel scared or unsafe, the therapy is not affirming, but rather helping them respond to those pervasive thoughts, feelings, and beliefs. Persons who are so deeply tortured by those feelings that they are, in fact, feel like they're in the wrong body. They are tortured by these beliefs that they have the wrong gender. They never experience a day when they are okay with who they are. Responding to these distresses is not about telling them to simply stop feeling this way or thinking that way. You don't tell a depressed person, have you ever tried not being depressed? Hey, just accept your depression and live with it. You see, in helping them learn to respond to these thoughts and feelings and beliefs, you help them learn to respond to these thoughts, feelings, and beliefs in a healthy way. It is not the thoughts, feelings, or beliefs. It is the distress that comes from the thoughts, feelings, or beliefs that focuses the intervention and coping. It's not the belief itself, but the response to the belief. Now, physiologically, the dysphoria, the deep-seated discomfort which produces pathological levels of distress and dysfunction, is caused by a medical rather than a mental difficulty. Now, this falls under the category of what we would call disorders of sexual development, or DSD. Disorders of sexual development refers to a group of medical conditions like an XXY chromosome called Klinefelter syndrome, or 45XO chromosome called Turner syndrome, or you might even have androgen insensitivity syndrome. And then there's several others where you get this malformation or an extra chromosome. You can have 3 or 4 or even 5 sometimes of an X or a Y. If you have these, then you have an anatomical, a chromosomal, or something wrong with the actual gonadal sex varies in some way, shape, or form. Now, when you look at those conditions, you have the idea of what is typical, what is within normal limits of either male or female. And in these medical conditions, the typical idea of this is what male is, this is what female, just doesn't exist. It doesn't exist medically. Now, the individuals with these conditions often refer or prefer the term intersex. Infants that are born with disorders of sexual development are often arbitrarily assigned either male or female. And that's done either by parents or physicians. And this, it could be purely arbitrary. It could be purely social in nature. Hey, this is the name we wanted this little person to have, so we're going to go this route. This is the pronouns we want to use as the clothing we want to, and it may involve some kind of surgery. People are discovering that this surgical procedure to deal with gender assignment in infants, this is highly controversial, and opinions on it really, really vary. At some point, it's not just about what their body looks like, but does the body match the chromosomes, those kind of things. When you read the diagnostic manual and you read the DSM-5 criteria for gender dysphoria, you realize that it was revised so that it talks about gender dysphoria, and there's a caveat, there's a modifier that says, hey, here's a person who suffers from gender dysphoria, and there is a physical reason, not just a mental reason, but a physical reason. They also suffer from DSD, or disorders of sexual development. The actual assessment and treatment of an individual with DSD presenting for gender-related concerns is largely the same treatment as any other transgender individuals. But even though the treatment is pretty much the same, helping them learn to cope with the distress, the distinction is, hey, this distress comes from an actual physical abnormality, chromosomal or anatomical, rather than just something going on in their thought process. In either case, the problem is not the belief, nor even the physical abnormality, the actual body part or chromosome or hormone. The problem, the focus of treatment, is the response to the distress. Now, when you understand that transgender or non-gender conforming people are struggling with distress that originates from a thought or a belief or a feeling that they don't fit their body, or that there's something wrong with their body, when you understand that's what this diagnosis is, then you must also understand this is not a moral issue. It is a mental issue. And by mental, I don't necessarily mean mental illness. You don't have to be mentally ill to be uncomfortable or experience stress over what you are feeling or what you think about your body. It becomes clinical or pathological when the distress reaches a level of dysfunction that it impairs daily living. When the distress over anything reaches a level of discomfort that produces impairment, what do? I've got this problem with my knee. I've got this problem with my shoulder. I've got this problem with my weight. And it becomes something that interferes with us on a day. What do? We seek psychiatric, medical, or surgical treatments. Now, that sounds extremes to us because we don't understand the fear, the pain, the psychic distress, depression, or anxiety that go along with these feelings of, hey, I don't fit my body. But people shave their heads, dye their hair, have their tummies tucked to get enhanced silicone renovations. They undergo liposuction. They join gyms. They eat vegan. They eat like a carnivore, and they do P90X because they don't like their bodies. And nobody ever says, hey, they're ill or they're mentally ill, all because they don't like something about their physical appearance. They don't like the way their body and their minds match up, and they do something to change it. Nobody ever says they're mentally ill. Gender dysphoria is an actual, real medical, psychological concern where, for whatever reason, be it a psychological concern or an anatomical concern, people say, hey, my body and my feelings about my body are incongruous, and it causes me a large amount of distress. Understanding that is super, super important in us being people who are sensitive, people who are being accepting, people who are being loving, and people who are being compassionate. Now, having said all that, there is a portion of our society that wants to take this very unique struggle, and by unique, I mean that in 2022, the UCLA School of Law, the Williams Institute, said there was 1.6 million people from ages 13 and up who identified as transgender. That is less than 1% of the population. But there's a group of people who want to take this very unique struggle and use it as a stalking horse for a different agenda. You see, the tragedy is that folks who are actually dealing with this are marginalized, misunderstood, and maligned because this true medical or psychological condition has been commandeered by a different group in order to push the boundaries of acceptance, in order to redefine sensitivity and inclusion and prove that perception is reality. They want to reject objective truth, and they want to ensure that their worldview should never be challenged, interfered with, or disagreed with. That's not what the transgender, gender nonconforming people want. They want to learn how to deal with the distress over what they feel about how they feel. Let me restate this. Transgender, gender nonconforming individuals are not delusional. Responding to what they identify as is not the same as treating the distress caused by that identification. You see, if you show up on American Idol and you think you can sing, it doesn't matter how affirming your family has been. It doesn't matter the fact that your choir director has lied to you for years in church. Someone on American Idol will hurt your feelings and send you home by telling you the objective truth. You can't sing. Even the Hollywood crowd understands that just because you believe something doesn't mean I have to believe it. So how do we respond to this? Well, I think you have to make the distinction between what we would call the true people, the true transgender, non-gender conforming people, and the folks who are using those terms as a masquerade. So what do we do when someone tells us there's something and they're clearly not? How does one respond with compassion and acceptance when we are told that they have an identity that is made up, misinterpreted, misunderstood, or simply a masquerade? If somebody walks up to you and says, I'm a cat, I'm a pirate, I'm an alien, my gender flows around like a kaleidoscope, that's just not how that works, because transgender, gender nonconforming people are not delusional. You see, if somebody tells you that they're transgender and it's postulated that way, then what's actually happening is a delusion and not a transgender issue at all. When someone presents their gender or species identity as a delusion, they're presenting with the wrong symptoms, and they're calling it transgender, and they're either really, really naive or they're just being deceptive. We were taught one thing from day one as ministers, as parents, as youth ministers, therapists, crisis intervention specialists: one does not enter into the delusion of the delusional person. The delusion may control them, but it does not control or influence us. The fact that they are having a delusion may be a factor, even a factor, but I do not respond to your delusion as if it were fact. The delusion and or deception affects them, but does not and should not have any power over me, my responses, my reactions, or my reasoning. I want to be careful, and I want to be clear again. There is a difference in what I consider actual transgender, gender nonconforming, and what has turned into this psychological epidemic using the concept of transgender, gender nonconforming diagnosis to disrupt school, to disrupt church, to disrupt sports, and to disrupt society. Let's use a term you've never heard before. Let's talk about the pseudo transgender epidemic. First things first, you understand that something is a pseudo epidemic, or something is not real when it can't be consistent. See, I'm just naive and I'm just pragmatic enough to ask this question: if body parts don't designate gender, then why is it important to alter them? If they don't mean anything, they don't mean anything. But people with a physiological abnormality that affects their identity, they will say, hey, my anatomy matters and I want to correct it. That's different than what we're being told is actually happening with our young people today. The other thing I want to do is when you talk about this pseudo epidemic, and it is an epidemic, it's just the transgenderism is the pseudo part. Let's identify what I would like to refer to as systemic symptom clusters. If you look at the families of the people who exhibit this, what I would call pseudo transgenderism, I'm not talking about the folks who are distressed by the thoughts and the feelings and beliefs, but people who are empowered by these so-called thoughts, feelings, and beliefs, then typically, and that's painting with a broad paintbrush, but typically folks who are using this as a way to exercise power or be empowered, you'll notice they come from isolated, rigid, extremely controlling, or people from religious extremism. They often have the perception that they have been unreasonably controlled all their lives, all their decisions have been made for them. And by the way, before there was the psychiatric epidemic of gender confusion, students who came from these kind of families, they responded to these environments by manifesting something the parents couldn't control. Hey, these are the people I'm attracted to. Sometimes it was girls attracted to non-church boys. Sometimes it was high society girls attracted to people from the streets. Now, in the modern manifestation of it, it's boys attracted to boys and girls attracted to girls. Gay as a means of rebellion, and not for the psychosexual reasons that typically comes in the developmental of a person's sexual orientation or a person's sexual self-identity. And that discussion is beyond the nature of this episode. And before we had kids who were dealing with the same sex epidemic, kids who fit that same profile came from those type families. They were the kids who pretended to be cutters. Now, again, there's a distinction between clinical manifestation and the cultural manifestation and the cultural phenomenon of cutting. Actual cutters are achieving what I call pathological mindfulness. But the epidemic cutters will show you their arms and show you their legs, and they'll keep you up late at summer camp saying, hey, did you know I cut myself? And they use that behavior because they don't understand it and their parents don't understand it as a means of rebellion and control. And before we ran in 15 years ago to the epidemic of the pseudo cutters, there were the emotionally conflicted and the goth kids. And before there was the goth kids and the emotionally conflicted, there were people who said they had eating disorders, anorexia and bulimia. Attention, 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 attention. This is not to deny the existence of these actual psychological disorders, but it's rather than deny, we distinguish between the true mental illness and the coping mechanisms and the adaptation or adoption of these behaviors and identities to deal with rigidity, inflexibility, hypercontrol, or a perceived rejection. Because from the systems they come from, they can't be good enough, smart enough, pure enough, athletic enough, or simply not enough. And because of that, they rebel or attention, 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 attention. The other end of this continuum, you'll find the same behaviors, but you'll find those same epidemics, but they're present in family systems that have no boundaries, not ultimate control, but there's just nothing. There's no boundaries, there's no limits, there's no accountability, there's no responsibility. And it's where children are or have been allowed to express themselves in any way that an immature adolescent mind could deem appropriate or fitting. And it's not that these kids are rebelling and saying, you can't control me, but they're screaming, how far can I go before somebody will adult up and give me some control? They want some boundaries, they want some securities, but because the adults are spineless, these kids are allowed to say, well, I'm this and I feel like that, and I'm going to do that, and this is what I'm going to be. And there's no adult in their life to say, no, really, we're going to make some adult limits and some adult choices here. In either case, these responses have been misinterpreted. I'm going to be transgender or gender nonconforming to control people, whether it comes from people rebelling because they have ultimate issues that they're being hyper controlled, or people are saying, hey, wish I had somebody to put the brakes on me. I'm going to see how far I can go before somebody calls foul. In either way, you respond the same way. We lovingly and compassionately acknowledge the person's perception without letting it control us and without letting it control the system, i.e. the family, the school, the church, sports, or society as a whole. It's exactly the same way we'd respond to somebody who was struggling with paranoia, schizophrenia, obsessions, compulsions, or phobias. Hey, look, I'm going to acknowledge this perception, but I'm going to refuse to allow a person who is unhealthy mentally to dictate my behavior. And I'm not going to let a person who's manipulative manipulate my behavior. I recently read a book about the Salem witch trials. And it's probably what sent me down this rabbit hole. Because in Salem, in 1692, four girls aged 9, 11, 12, and 17 faked physical symptoms, or they chose to connect real symptoms like seizures with false and fabricated testimony that resulted in the accusation of more than 200 people. Of those 200 people, 30 of them were found guilty of witchcraft and 19 of them were executed. And it was fake, it was false, it was made up. It wasn't delusional, it was deception. Now, the culture they were in, it was the perfect storm. Their symptoms and accusations could not be denied because they were consistent with the cultural beliefs. They were consistent with the isolation, the religious extremism, and the strict, overly rigid, hyper-religious, witchcraft-obsessed puritanical culture. If you tell me that there are such things as witches, and I tell you I saw one, how can you tell me I didn't? If you tell me that there's such a thing as witchcraft, and I tell you, hey, well, a witch is afflicting me, how can you tell me it's not? These four teenage girls weaponized a culture of fear and intolerance against itself. And I believe to a large extent, when you get into the pseudo-transgenderism, some of these modern kids are weaponizing the absence of objective truth and the objective reality against their families and against their systems. The identity question is working much the same way. And it's not that we're running around accusing people of being witches, but the scientists and the adults and the therapists and the ministers are being put on trial because we're telling people that witches aren't real and they don't exist. Because somebody has taken a real physical, a real mental struggle and commandeered it for their own purposes and their own agenda. So they can either rebel against control or act in such a way to say, well, somebody put the brakes on me and please give me some control. At best, it is adolescent attention-seeking behavior, and at worst, it's a desire to leverage power and will the modern sensitivities against us and make all the adults look like and behave like total fools. When you get away from the actual diagnosis of gender dysphoria, it's not about fantasy, but about facts. We have an obligation to speak up and simply say the emperor does not have new clothes. In fact, someone has to say the emperor is not wearing any clothes at all. It's not wrong. And it's not unkind. And it's not unchristian to say, you know, you really aren't a cat. You really aren't a pirate. You really aren't a Jedi. You aren't another gender, and you're not a 400-year-old FBI agent. And if you tell me you are, and you don't have some objective proof, you don't have the DNA of a cat, and you don't have credentials from Quantico, and you don't have a birth certificate that goes back 400 years, then either you're deeply ill, you're deeply disturbed, or you're just dishonest. We started with a fictional cop, and I'll end with one. There's a fictional LAPD sergeant on the show Dragnet. He used to say, all we want are the facts, ma'am. He would also say, all we know are the facts, ma'am. Now, maybe that's not the quote you remember. Maybe that's not the thing you were thinking I would say. But Joe Friday never said, just the facts, ma'am. No matter how badly we want to believe it, those are not the facts. Using the tool of shortwave radio, World Christian Broadcasting literally covers the world every day with the gospel. They use two large curtain antennas. One is located in Anchor Point, Alaska, and the other in Madagascar. They send out messages that are recorded at their international home in Franklin, Tennessee. They make available 40 hours of broadcast every day. The broadcasts are made in English, Chinese, Russian, Spanish, Portuguese, Korean, English for Africa, and Arabic. They would love for your group to visit them. You can bring your ladies group, your youth group, or your men's group. Just give them a call at 615-371-8707. 615-371-8707, or you can go to worldchristian.org, find the donate here button, and make a financial contribution to support this work that literally covers the world every day with the gospel. World Christian Broadcasting, in cooperation with Keeping Up with Jones, the Lonnie Jones Podcast Adventure.